All right, well, welcome IFA friends. My name is Mike Lehman from IFA Government Relations, and thank you so much for joining us today. We are happy to bring you this special IFA Government Relations webinar program called Mandate to Vaccinate, ? And today's program is all about the recently promulgated temporary rule that we've all seen that requires nearly all US employers with at least 100 employees to ensure their workforce is A, fully vaccinated, or B, tested weekly for COVID-19. So again, thank you for joining us. We've got great speakers today, and you will hear both the franchisor and the franchisee perspective on this program, as well as all the details of what we know at this hour about the rule and the most recent court preliminary injunction against the rule and what that means for franchise. So a few announcements before we introduce our three great friends and speakers today. First, today's webinar is being recorded. So the recording and slide deck will be available on IFA's community site later today. And that's at community.franchise.org. You can forward that site to your colleagues who missed the live program today. That's community.franchise.org. And second, we will take questions from the audience at the end of the program. So at any point, you are encouraged to enter your questions into the chat function on your Zoom screen, and we will pose as many of the questions at the end of the program to our experts. Okay, let us introduce our great speakers this morning. Actually, let's do that slide, Madeline. Thank you. While we have everyone, we wanted to flag that IFA's 2022 convention in the spring is in person, and it will be in San Diego, California. And by late February, everyone will love to be in beautiful San Diego with all of us in person, sharing and learning from great experts like those of ours today. So please go bookmark franchise.org/convention to sign up for our first in-person convention in 2 years and be a part of the franchise community's biggest show in San Diego next spring. Okay, with that, let us get into our program and introduce our speakers. First, we have Cheryl Stanton, who is Chief Legal and Government Affairs Officer for Bright Star Home Care. Cheryl comes to Bright Star having most recently been Wage and Hour Administrator at the U.S. Department of Labor from 2019 to 2021. And she was also the South Carolina State Department of Education and Workforce Executive Director. Cheryl is a new member of the IFA Board of Directors, and her perspective will be invaluable this morning. So we're thrilled to have Cheryl here. Welcome, Cheryl. Next, we have Greg Flynn. Greg is founder, chairman, and CEO of Flynn Restaurant Group and Flynn Properties. Greg's system owns and operates more than 2,000 Applebee's, Taco Bell's, Panera's, Arby's, and more restaurants across the country. And Flynn Restaurant Group is the largest franchise operator in the United States. So Greg has unique insights into just how this rule will work for complex franchise systems like many of yours on the line. And Greg is also an IFA board member, so welcome, Greg. And third, and our first speaker this morning that you're about to hear from is Jim Peretti, shareholder at Littler. Jim is a longtime Capitol Hill and executive branch staffer and counsel, and he's a real friend of the program. Jim also headlined our original rapid reaction webinar for us back in September when the White House first announced this rule was coming. So we are very pleased to have him back. So Jim, thank you for being here. Welcome, and the floor is yours.
Michael, my pleasure, and good morning, everybody. It's been in what seems like only a handful of days. It's been a couple of months. They're long and they're hard, and we're all trying to figure out where we're going and how best to do. So I am going to walk us quickly through where we stand with the OSHA ETS. Do want to leave time for questions. Slide, please. Agenda's up on the screen. We'll talk about the timeline, where we stand, what the ETS requires. I have put, you will see, I know these slides are going to be made available to participants today. There are more slides today than I will cover in the interest of leaving time for questions and for a robust discussion with our panelists. But just to briefly start, a slide, please, where we stand as of today. So September 9th, the president announced the path out of the pandemic. That included a vaccination plan, called on OSHA to issue an ETS, a federal contractor executive order, which may be relevant to folks on the call who have, concessions on military bases or other contracts with the federal government, Medicare and Medicaid instructions. So, September 9th sort of started the ball rolling with the, all this is coming. Next slide, please. On November 4th, which was last Thursday, which, as I said, seems to be about 6 years ago, they finally issued the proposed ETS. And this test sets a January 4th date for compliance for private sector workers to become vaccinated, or alternately to show proof of testing on a weekly basis, less so if they're coming into the office less frequently. But this thing was published on, or previewed on November 4th, published on November 5. Next slide, please. And by November 6th, the United States Court of Appeals for the Fifth Circuit, that's based down in Texas, next slide, had enjoined the, issued a temporary restraining order holding the ETS in no force and effect. Slide. So to give you guys just a sort of quick and dirty of where we stand now. So the Fifth Circuit, as I mentioned, on Saturday morning issued a temporary restraining order. We view this to be on a nationwide basis, that the ETS is currently on hold. As a practical matter, that probably employers are starting to think about compliance, but the deadlines they had set out, including a December 5 deadline and the January 4 deadline, I don't know that folks were taking steps beyond starting to prepare. You should be aware that, so the government's papers were filed in response last night. Strike that. The government's papers were filed on Monday. Petitioners filed their papers last night. So very soon, the Fifth Circuit will entertain whether or not to convert its TRO into preliminary injunction. But because there are numerous challenges to this rule, there's been state attorney generals filed in a number of different federal circuits. So we have at least 4 different circuits where challenges are pending. Another one was filed yesterday by the American Trucking Association. What happens now is all of these cases will be consolidated. They will sort of pick one of the circuits in which an appeal is a challenge is pending, and that will become the circuit that sort of decides on a nationwide basis, does this law stand, or does this statute fall? Of note, we heard yesterday from the Solicitor of Labor that the department is aware that, given the legal uncertainty here, it is very possible that some of these dates that are set forth in the ETS, including December 5th for a compliance program, January 4th for a vaccination requirement, these dates may in fact slip. But for many folks now, they're asking, well, what should we be doing today? And there is a little bit of a stay tuned. We'll talk about looking at the ETS. What does it mean for you and your business? But I think the next week to 10 days is going to give us a little more clarity as to whether this standard is going to prevail, whether it's going to be enjoined until a full adjudication on the merits, which would take some time. So we are sort of in a wait and see mode. And what I'm counseling clients to do is, today is not the day to go and buy 6,000 test kits or to start separating employees who haven't been vaccinated. It's a good time to be thinking about what do we need to do if this thing ultimately stands, and then we'll talk about the substance of it. But for the moment, to the extent you're able to, it is we're sort of in a bit of a wait and see as we get, as this thing unfolds. I think there are significant bases for which the ETS can be challenged. We'll talk about those as we go through it, but we simply don't know. And ultimately, this may be one that if the Fifth Circuit or the 9th or the 11th Circuit says we're striking it down, will this make it to the Supreme Court? I would think probably so, but I think that still remains to be seen. But that's where we are as of today. Let's talk about, and for the rest of my presentation, we're going to assume this ETS goes into effect, that it survives legal challenge. So what is the substance and the scope? Next slide, please. It was issued November 5. As I mentioned, these are our compliance dates: December 5, January 4th for either proof of vaccination or weekly testing. The administration estimates that it covers about 80 million private sector workers. On the same day that they issued this, they also issued one applicable to folks who participate in the Medicare and Medicaid programs. Also, as I mentioned, there is a federal contractor executive order out there. And for the good news, if it is slightly good news, is that they did take the position that if you were covered by one of these standards, your work site, that's the one that governs you. You're not going to try to be complying with 2 or 3 different standards in the same work site. So that, that has some bearing for folks who may cross over from federal contracting into non-contracting, et cetera. But what's in the ETS? Next slide, please. So by January 4th, employees to be able to work on site need to either show acceptable proof of vaccination or otherwise start to submit themselves to a weekly testing program. And the dates on that and sort of how that's going to be administered, when is someone's first shift, those are going to vary based on what your scheduling looks like and things of that sort. But important to note, while we traditionally talk about fully vaccinated as being 2 weeks after a vaccine, with respect to that January 4th date, if someone gets the second shot, let's say they're doing a 2-shot Pfizer or Moderna, if they get that second shot in their arm at 11:59 on January 4, they're covered. They're good to go, notwithstanding that for 2 weeks they wouldn't be fully vaccinated. If they don't have that second shot by that date, even if they're scheduled to get it on January 5, they likely need to test until such time as they're fully vaccinated. Also, as of the compliance date, employers must have a written COVID vaccination policy that covers a number of things, including whether it's a mandate, whether you're allowing for testing, anti-retaliation language, a reminder to employees that providing knowingly false information with respect to vaccination status may subject them to criminal penalties. So the first step for many folks is going to be, do we have a policy? What is our policy going to be? Are we going to do a hard mandate that says everybody must be vaxxed? Are we going to allow folks to test out in lieu of vaccination? I'm not going to get into too deep into the weeds on reasonable accommodation for folks with disabilities or medical, but that's something you need to be considered. And obviously that will factor into your equation. Next slide. And final note, it does require, we can stand, does apply to new hires and new employees. I have clients saying, hey, if we're going to have to make sure everyone's vaccinated, can we just tell folks, if you're not vaccinated, we're not going to hire you, we're not going to consider you for employment? And the answer is that's probably not the route to go. I think to be compliant with your non-discrimination laws under federal and state law, you probably want to make available that we require vaccination pursuant to the ETS. We expect employees to be vaccinated. If you do need an exemption from this for medical or religious reason, we'll entertain one if we're able to do so. So, who does this cover? And it's employers of 100 employees or more. And you are counting most all of your heads. For purposes of this sort of threshold standard, you count part-time workers, you count temporary workers, you count minors. This is not one where we're only going to count, the folks who are there full-time. It's if you have 100 as of that date, you are covered under this. Note to self, let's say you are at 95 as of November 5th, you're not covered. You say, okay, we're at 95 employees. If you hire up, if you hire 6 people and you go into 100, you will then trigger this requirement and you are covered. And the thing is, this is like one of the famous, what are they, the Roach motels. Once you get in, you don't come out. So if you hire up, if you're a seasonal employer, you hire up to over 100, you trigger this requirement. If you then drop back to 80 or 70 employees, these requirements still stick with you. So I do have some clients who are saying, hey, we're planning some growth. We're at 75 employees now. We were thinking of hiring a bunch going into the next quarter. It may be time to say, if we're not hitting that threshold, maybe we want to hold tight and do that. I saw a question pop up in the chat about separate legal entities, and this is going to be a challenge for some. They make clear in the rule that under normal circumstances, let's say, certainly with respect to a franchise, if you operate a franchise, let's say you have one franchise, you have less than 100 employees, you are not covered by virtue just of the fact that you're franchise. You're not rolled up with other franchises. You're not rolled up with the national brand. Each business stands on its own 2 feet. I think a more complicated question, what came up in the chat, is What if you are multiple units and multiple franchise holder? How are they going to look at that? Are you going to get aggregated? And the ETS speaks very briefly to this. It says, in general, franchises stand on their own unless safety policy is, sort of coordinated by the same control group. So if you have 5 franchises and really your HR policies, your safety policies, your workplace protection policies are all being set at the top, that is going to, that may be an instance where all of your franchises are aggregated. Alternately, if it is simply, a holding company situation and each franchise has its own leadership, sets its own policies, dictates its own, its own corporate standards, for truly maintaining, what I would call the not piercing the veil, these are separate businesses that stand on their own, then you have a strong argument that you're not aggregating them. But I don't think it's as simple as, they operate under separate EIN numbers. It will be more than that. And I think, OSHA traditionally has looked to how does the business operate? What is the right of control? It's a lot like when we were talking about in other contexts, we've talked about joint employer status and, what that means and what are the factors people look at. So if it's really being operated as a unified enterprise, the fact that you have 5 separate, LLCs may not be enough to get you there, but this is going to be a very fact-based equation that you are going to want to consider based on your locations. Question in the chat, what if employees are employed through employee leasing companies or staffing agencies? The ETS speaks to that and says, staffing agency, leasing companies, they are employees of their leasing company or staffing company employer. So you really are counting only your own W-2 employees for purposes of whether or not you trigger that 100. Next slide, please. I mentioned earlier, the ETS does not overlap other federal mandates. So if you are subject in a workplace to the contractor guidance or to something else, you're not going to be required to with the ETS. Next slide. State and local, it does. So one big issue we are getting from folks is that, hey, the governor of Texas has issued an order that says if someone's previously been, exposed to COVID, they don't need to be, show proof of vaccination. I can't require them to show me, to be vaccinated. OSHA takes the position that the federal standard it's adopted supersedes and preempts state laws that otherwise would limit, relating to testing, to vaccination, to other mandates or to masking requirements. We will see, I think, if this standard holds, I think there's an argument that it is preemptive of laws that are in conflict, but we don't know that the law is going to hold yet. Also, when you look at the FAQs, and I would encourage everyone to do that, if you go to osha.gov, they will take you to the standard, but they have an actually fairly good set of understandable, frequently asked questions. Sometimes these things are terrible. These are actually fairly good in terms of, speaking English and being able to be readily understood. But they certainly take the position that the ETS doesn't preempt state rules that are more protective. Maybe a rule that says you have to provide additional, more time than the ETS requires for getting vaccinated or for recovery from side effects. So as a rule of thumb, if the state is requiring you to do more, you are probably subject to those additional requirements. If the state is purporting to say you have to do less or you don't have to meet the standards, the minimum standards set forth in the OSHA standard, at least until such time as its legality is determined, those laws OSHA maintains are preempted. Next slide, please. Next slide. So basically you have 2 options here. One, what I call the hard mandate is you require every one of your employees to be vaccinated. You must show us proof of vaccination. We will entertain religious or medical disability exemptions. And for those folks, they are going to be subject to weekly testing. They're going to have to be wearing masks. But it's basically your option to say, are we going to allow people to test out? You may, but you are not required to allow for that test out option. We require you to show proof of vaccination. Alternately, if you're not vaccinated or you haven't shown us the acceptable proof, you have to submit to weekly testing. And that's certainly anyone who's coming in on a regular basis. It's going to be testing once every 7 days. I do get the questions about, well, what if we have somebody who only comes in periodically? It's not regular schedule. If you have someone who's in that position who may come into a work site once a month, it's a supervisor who's making an inspection, then you may be able to just test that person before within 7 days that they're coming into the workplace. But in general, that's really the first big question you're going to have is, do I require vaccination in all instances other than where there are exemptions, or do I allow for this test out option? And that's going to really be dictated by what is the nature of your workforce, what is the vaccination status of your folks, what is your labor, labor availability right now. I know, restaurant franchises on this call will be the first to tell me we can't get folks in our restaurants. We just, the labor supply is not there. I've seen that in my own travels. So this is sort of a threshold question you're going to want to ask yourself into what's right for my business, what's going to work right for me. Next slide, please. Someone has asked about, so what is acceptable proof? Up until now, we have been, saying if you have the employee sign a form that says, yes, I've gotten my vaccination, here are the dates in which I was vaccinated, I certify this is true, signed Jim Ferretti, that was generally going to be acceptable. The rules of the road change once this mandate becomes effective as of December 5, assuming that date holds, at which point that sort of just sign a form or the honor system is not going to be any longer acceptable. If someone wants to show that they are fully vaccinated, they'll have to show the vaccination card, certification from a healthcare provider, medical documentation, and this is something the employer needs to maintain. They don't have to maintain it for 30 years, but for at least as long as the standard is in effect. Next slide, please. Someone asked in the chat, what about an attestation? What about that form? Two things to note here. One, if you've previously surveyed your determined your vaccination status by way of those forms, anyone you've done prior to November 5, that's fine. Those, you don't have to go back and recollect or re-verify and say, now, Jim, you signed, but now give me your card. However, going forward, there are going to be very limited circumstances under which you can accept that attestation. And that's employee has been vaccinated, I've lost my card and I can't obtain another card, which I think is already a little bit difficult to argue. There's no other way. I can't get my doctor to certify. And if you do that, you do have to include some language in there that providing false information may subject the employee to criminal penalties. Basically, it's very clear here. The ETS is pushing on. We want to make sure folks are vaccinated, and we're not looking to entertain, oh, I promise I did it, or opening up the possibility of folks just saying that they did. So limitations on what you can do for attestation going forward. Can I get the next slide, please? Documentation. Folks have asked, what do I have to maintain it, and do I have to send a list to OSHA? The good news is you do not have to send a list into anybody. However, you are required to maintain a roster of all of your employees, who's vaccinated, who's not vaccinated, who's receiving an exemption, whether they are partially or fully vaccinated. You need to maintain that list. You need to provide it in the aggregate to an employee or an employer representative if they ask. You don't need to list names, but to say, oh, we have 150 employees on the work site, 120 of them are vaccinated. But more important, this I think is going to be where OSHA comes in. If they come in to inspect, you need to, within like 4 hours, be able to produce this list to OSHA if they do look for it. So it's something I think as we roll forward, this is something you're going to want to maintain, and you're going to want to maintain it on a going basis. Next slide, please. Next. ETS requires that if you're covered, you have to provide up to 4 hours of paid time at regular rate for each dose of the vaccine. So if you have someone who's doing a 2-dose, that's 4 hours, up to 4 hours for each. It's obviously doesn't have to be 4 hours in all instances. You cannot require them to use paid leave or other time off for this purpose. Also, you should be mindful state and local laws may impose different requirements, and that vaccination pay is required even where testing is an option. Next slide, please. Also, paid time off for recovery from side effects. The ETS says it's reasonable paid sick time, and they generally say that up to 2 days per dose to recover would be reasonable. This is one you can run if the employee has accrued sick leave or sick leave of that sort. You can require them to use that leave. You can't require them to use vacation. If you have just one bank of time, one PTO bank, you can require that. So it's really sort of, it depends on what your policy looks like. What you can't do is say, okay, you don't have any accrued sick leave, you're stuck. If they have used up all their sick leave, the only thing they have is vacation, you can't require them to do that. You have to extend them some additional leave. You can't require folks to go into a negative balance. So Again, this, even where you're offering the testing option, if someone gets the shot and needs the time, you have to give it to them. Next slide, please. Next. Testing options, as we said, you must mandate testing for unvaccinated workers. That's going to include folks who are receiving exemptions unless there is a religious objection or a need to accommodate testing. It may be required testing for vaccinated workers. You're not prohibited from doing that, but you're not required to. And it's, you have to look at what other safety protocols. Certainly, if you have non-vaccinated workers, they are going to have to test. They are going to have to mask when in the workplace, et cetera. Next slide, please. Big question, do you have to pay for the tests? And this is one I'd love to say, here's the easy answer. Unfortunately, I can't say that. The ETS says nothing, OSHA is not requiring employers to bear the cost of testing. However, state and local laws may require otherwise. Other federal laws may require otherwise. If someone needs to be tested because they can't get the vaccine because of a disability, it's generally our consensus that you are probably going to have to be paying for that test and conceivably the time for testing. Even where you have folks who say, nope, I don't have a disability, I don't have a religious objection, I just, all things equal, I'd rather get the test than have to, than get the vaccine. You're going to need to look at state and local laws around wage and hour, business reimbursement. I'm looking at you, California, where an employee you host a company picnic in California and the employee gets a piece of sandwich in their tooth, you're stuck on the hook for the toothpick. So I think you need to look closely at state wage and hour requirements, as well as a number of states where employers are required to pay for employment-related medical examinations, separate and apart from general business reimbursement. So this is one you're going to want to dig into, and you're going to want to consult with your counsel and HR, because there is not a one-size-fits-all answer on this. Can we simply push the costs on? It was widely reported, OSHA says if you don't, employers don't have to bear the cost, but sort of the fine print says except where they do. So that's a tricky one. Next slide, please. State laws vary. We talked about that. Next slide, please. Same thing. Mileage and such is not required, but you may also have to deal with issues of compensable time. If I have exempt employees, non-exempt employees rather, and I'm requiring them to get tested before they come in, do I have to allow for that? Next slide. And finally, we've, the question folks have asked, and I am going to cut the deck and turn to my panelists, what tests are available? And the ETS lists out a range of them, plainly something that was administered by, a pharmacy, your physician, a telehealth provider, if, you have someone proctoring it. An at-home test is generally not permissible unless the employer is supervising it or otherwise monitoring it. So it's not okay for Jim to say, you send me a test, Jim tests at home and says, yes, I tested clean today, I'm coming in. It would be permissible for Jim comes to the work site, Jim tests, start the clock when Jim tests, because otherwise it's going to, if you start me 15 minutes before my shift and I have to stand there and wait for the test, you're probably going to have to pay me for that time. But if the employer is verifying the test results, so Jim comes in, Jim does the, swab and puts it in the thing, and we wait 15 minutes and it shows yes or no. Those sorts of testing, what I'll call the rapid, point of contact testing is permissible. But when we say at-home testing, generally not going to be permissible for an employee to simply do it. And, as they say, self-administered and self-reported. So that, what sort of test you're going to use, what's available, and how are you going to do that? Things you're going to want to think about. OSHA has made clear we may have shortages of tests, and if that's the case, and generally, before I turn it over to my colleagues, what we've heard from the Department of Labor is we're looking for good faith compliance here. OSHA is not going to paratroop into your facility on January 5 and say, show me your vax cards. And if you're out of compliance, we're going to start throwing fines around. I think if you say, hey, we have a program, we have a policy, we are collecting this information, we've got 90% compliance. I think if you're able to show those good faith efforts, that's what I think the standard is going to be, at least in the short term, until this thing becomes, a more permanent standard, which it may. The emergency temporary standard is good for 6 months, or until a final standard is issued. So with that, I'm going to turn it over to my colleagues. I know they have some remarks, and then we'll entertain some questions.
Jim, that was tremendous. It's remarkable you could read a 500-page rule like that in a week, let alone give us such a great readout on what is the most sweeping OSHA regulation ever. affecting many of our folks. So thank you so much.
Weekends are over.
And for fielding so many questions on the fly so nimbly. So thank you. Before we turn to our business speakers, and we're going to get Greg and Cheryl into the conversation in just a moment, I did want to put a fine point on the franchise provision in the rule that Jim referenced. There really is excellent language protecting the franchise business model buried in this 500-page rule. And it says that where each franchise location is independently owned and operated, the franchisor and franchisees will be separate entities for coverage purposes of this rule. So that's in the joint employer era, to have candidly a Democratic administration promulgate that kind of language is hugely important. And there's no accidents in Washington, D.C. And this great language is in no small part due to all of IFA's advocacy working with all of you, but also our recent small group meeting with the White House on the rule before it was promulgated. Full stop, all of our advocacy matters and makes a difference. So thank you to everyone on this line for what you do and how you can really impact your day-to-day business.
Yeah.
Now it's a
big attaboy to IFA on this one, because that, to get that language in there, that's the first time we've seen something like that throughout this pandemic with paid leave and other things. To get that sort of very good line, I mean, that was really, at the risk of giving Mike and the IFA team a pat on the back. It's well deserved, because that, as you said, that did not show up in there by accident. That was only because of what you all did. So that's a big win for you guys.
Thanks, Jim. You're a big part of the team, so thanks for what you do. And I will note, as we segue into Greg Flynn, one of our participants in the IFA small group meeting with the White House a couple of weeks ago, giving feedback on their rule, was Greg Flynn. And he's a big reason why we secured this language in the rule that franchises should be treated separately. But there's a lot of other complexities in the rule that Jim outlined. And so Greg's going to get into some of that. So Greg, thank you for being here and welcome. And we would love to hear your view of the rule and how it may affect your people. Greg, I think there we go.
Hey, thanks, Mike, for having me. And thanks, Jim, for that excellent exposition. The challenges to the rule may or may not succeed. We need to act as if it is going to stand, and as if it's the law of the land. And so we're preparing to comply. The only question is how, and that's not easy. So we employ 73,000 people. So the first challenge is data collection. The ETS requires that you determine the status of all employees. You maintain records of whether or not they're vaccinated, but then you must, maintain proof of vaccination for those who are. Except our understanding is that that is considered a medical record, so you can't put that in the employee's file. It needs to be maintained separately. So there's just a challenge in how you do that. We're probably going to be collecting all of this information and compiling it centrally through an app that we may develop or we may source through a third party. We don't have a lot of time to do this, so we're making decisions very quickly on that. The second really is about, do you require vaccination or do you offer a testing alternative? The goal of the ETS, of course, is to get more people vaccinated. So it deliberately makes it, kind of difficult to allow the alternative of testing and masking. It does require paid time off for vaccination and for side effects, if any. And that's, of course, because they want people to get vaccinated. But at least the ETS itself doesn't require paid time off for testing or for employers to cover the cost of the test. And as Jim rightly pointed out, there are states that almost certainly will require employers to cover that cost. Like we have 105 restaurants in California, and I just assume we're going to have to there. But there are a lot of states that aren't going to land that way, I would guess. So employers could require employees, we're permitted to arrange for and pay for their own testing if they are offering an alternative testing. And my guess is that many will do that. The biggest problem with that for employers who are subject to this, which are large employers, is that the bifurcation of the law between large and small employers causes a real risk to large employers. We have a staffing crisis right now that everyone's familiar with. Honestly, we can't afford to lose anyone right now. And if our employees don't wish to be vaccinated, they don't wish to subject themselves to weekly testing, even if we provide it and masking, they can walk across the street and get a job with someone who's not subject to the ETS. And that's a real risk. So, I think this will lead some employers to provide testing and make it as easy as possible for employees to stay who don't wish to be vaccinated. The problem is this undermines the goal of the ETS itself, which is trying to cause people to be vaccinated. But it almost puts us in a position where we need to, sort of facilitate a contrary outcome here. I think the whole thing is going to require a lot of agility. First of all, it may or may not, be successfully challenged in the courts. But we're going to learn as we go how this actually plays out with our employees and what we need to do. And we know we need to comply, but we actually don't know how much of a problem this is going to be. But we've been in places like this before where, we faced a lot of uncertainty. The week of March 13th last year was probably the ultimate. We made it through that, and we'll make it through this too.
Greg, thank you. We really appreciate your perspective, and we will pull you back in here to the Q&A in just a moment, if that's all right.
Sure.
And but we want to bring in Cheryl Stanton of Bright Star Care into this conversation. As we mentioned, Cheryl is an alum of the Department of Labor as a top official there until the first part of this year. And of course, now she oversees the great Bright Star system. So Cheryl has unique insights to the process that brought us this rule, at least we can say. So Cheryl, welcome again to you. And we would love to hear your take on the rule, particularly from the franchise brand perspective.
Thank you, Michael, and thanks to everyone at IFA. I know I'm a little late to this, but I will reiterate the impact of IFA. I saw it when I was on the DOL side. I see it as I watch Senate and House hearings on a regular basis, and I see it in the output we're getting even now from DOL. So incredible organization, really proud to be a part of it. So thanks for having me today. I'm going to actually back up a little bit to when President Biden took office, because at that point, you may recall he instructed OSHA at that point to do an ETS on vaccinations. We all waited with bated breath, particularly after March 15th, as the deadline for that ETS came and went. And this summer in June, that an initial ETS was issued that I don't think there were broad webinars or things like this because it was limited to healthcare providers and to healthcare officials and employees in terms of vaccination. Why do I say that? Because here at Bright Star Care, we have had to think about vaccinations since this summer and how you would have vaccination programs because of our caregivers, our nurses, and in that nature. So it was particularly interesting to us on September 9th when the president came out with what he was calling and describing as vaccine mandates. And I'll circle back to why I think that messaging is important and impactful and going to really influence how we approach this kind of program. I say this because on September 9th, it was not just this OSHA ETS that he announced. It was an executive order regarding federal contractors, as well as direction to CMS to issue a rule regarding Medicare and Medicaid facilities. That the second obviously impacts us to some extent when we send staff into facilities that may have funding from Medicare and Medicaid. And that CMS rule is actually a vaccine mandate. There is no escape for weekly testing or anything of that nature. Similarly, the federal contractor EO does not apply to our model per se, our branch per se, but it may affect you all. So for instance, if you are a QSR, but you happen to be in a hospital, you might get swept in under that federal contractor EO. Or if you are, a supply chain and you guys supply to federal buildings, you may get pulled in under the federal contractor EO. And that makes all of this even more complicated. It certainly complicates this for us because what happens under this existing ETS, which I will call the November ETS, is it looks backwards and it says, if you're covered by the June ETS, you stay covered by the June ETS. And if you're not covered by the June ETS, you're covered by the November ETS. So while there is some attempt to equalize dates and things of that nature, I think as brands and as entities, we need to really be looking at all four and asking which pieces might apply to which of our employees. It's further complicated if you are in the healthcare space because the ETS from June expires in December. Lots of questions. How does that roll off? What does it end up doing? Do they roll on to the November ETS? Will they extend the December ETS? So as all the panelists have previously said, there's a lot of confusion around this and a lot of things we've got to work out, but that we will, as Greg said, we always do. What I do want to talk about with this November ETS is it's kind of ironic in that this is pretty much where we as a franchisor and a franchise in our headquarters came last summer. We have informally been basically saying to people, let us know if you're vaccinated or not, but we did it very informally, not with a roster and heavy documentation. And if you're not, go get tested weekly, and before you come into the office that week, just send us your negative results. So we've already been kind of really mirroring what this rule does. And so in some ways it shouldn't feel like a big change, right? We got to do a written plan now. It was an informal process we had in place. And by the 4th of December, if the rule stands, we need to go ahead and have the procedures written out in detail and send it to everyone in our franchise headquarters. Similarly, we've got to shore up our documentation. We got to create that list. We got to be getting the actual documentation to back it up. All of those things, which is a little bit of a change. Masking, we had a state mandate on masking inside of offices. It changes it a little bit if you're unvaccinated because there was a little more leniency if you were in your own space. Now, unless it's a closed door wall, floor to wall, you have to keep the mask on and carols and things like that. Similarly, I don't know that we were telling people they couldn't do at-home tests. Now we're going to have to make sure what kind of, to the point I think Jim was making, what kind of tests they're doing. And so, it's a lot of documentation. It's a lot of administrative burden. I think what kind of surprised me the most about this ETS, though, is the impact it's having on our culture and how we have to think about that. And I will tell you, we've kind of seen it in two ways. One, when this first got announced on the 9th, again, the president really teed this up not as a workplace safety standard, unfortunately, but as a vaccine mandate, which led to triggers in the employees. We got a lot of email back and forth at that time from employees, either, trying to figure out how they could get out of a mandate. These were employees who were already doing the weekly testing and sharing their results. So in some ways, it doesn't really impact what they're doing, but the mindset was changed and flipped. And people asking for religious exemptions, people asking to move back to full remote at home so they wouldn't be covered, things like that. That quieted down for a little bit until we got the rule last week. And we did a little bit of a quick announcement on our every other week kind of staff meeting to try and just tell people that we're looking at the rule, we're evaluating it, and really that there wouldn't be a lot of change in that we were already requesting those who weren't vaccinated to submit negative tests. And we were already asking people to mask in the office, and it would be a lot more documentation and a lot more a little bit more shoring up and formality to the program, but not a lot in terms of change of behavior in our program. And yet the questions and responses exhibited a strong hostility and strong framing of this vaccine mandate. This is going to get me fired. And it was a lot of emotion and reaction to the perception of this ETS being a vaccine mandate, when in fact, if you really look at it, it is a program of if you are not, unless you choose to mandatory vaccinate, it gives the option of a vaccine or testing option. So I think one of the things as organizations we need to think about, unfortunately with this one, is not only the kind of nuts and bolts of how to get ourselves and our employees into compliance, but it is going to be an impact on our culture and the perception of employees. And we're going to have to work really hard on messaging, on supporting employees and of trying to de-escalate it away from this, you must get vaccinated under this ETS 2A. There are ways we can be flexible with you with testing, with masking, because I agree with Greg, our biggest challenge right now is workforce. And if we don't not only execute, but roll this program out correctly, it is going to impact our employees.
Cheryl, thank you so much for that. And we'll want to keep you a part of this conversation as we begin Q&A, but we really appreciate you, Cheryl, for being a part of the IFA community. And everyone should know that Cheryl remains the last standing wage and hour administrator, because as we'll say on this family program, IFA continues to pound the nomination of David Wild to be the next wage and hour administrator because of his very candid anti-franchise views. So just more IFA advocacy results for you there. So, but thank you, Cheryl. And now let's do Q&A with and pick up on questions from where Jim left us off. And you can see we've got about 12 minutes left. You can see all of our email addresses on the screen. So if you don't get a question that you submitted read this morning, you're welcome to contact any of us after the program. First question, administrative one, will slides be sent to all attendees after the fact? They will. If you're registered for this program, you will receive both the program slides and the recording after later this afternoon. All right, next question is, and Jim, this is probably the first of many perhaps posed to you, and this really is a 50-cent question. So we talked about the franchise language that sort of that preserves the franchise model, but how about franchisees that have separate legal entities for each location? Are these going to be aggregated for the 100 employee threshold?
Yeah, and again, I think it's going to turn back to, separate legal entity is certainly a good place to start. If you didn't have that, then I think you'd be in trouble. But I don't know that that is going to single-handedly carry the day. It really is going to depend. What does my operation look like? If realistically, Jim has 5 franchise restaurants in this Washington, D.C., where I live, and while we have a manager at each, as a practical matter, even if they're set up as separate legal entities, Jim sets the terms and conditions of employment. Jim at the highest, the Jim Co. as the holder of all these sets workplace safety policy, determines, okay, we're going to go hard mandate or we're going to allow for testing. It's again sort of focusing on that concept traditionally of control group and what they did not give us specific affiliation rules, but OSHA has in the past looked to traditional concepts that we're familiar with from joint employer and other areas to say, okay, this is where the operations are so effectively one operation that it's going to get rolled up to be a single employer. So that's really going to be an operation by operation question. But those are the things they're going to look to and turn on there.
Thank you, Jim. You touched on remote workers, Jim, but if you work remotely, how will weekly testing be mandated for remote workers?
If you have employees who are fully remote, whether they always have been or during the course of the pandemic, obviously that's not going to be someone working in your restaurant, providing care for one of Cheryl's, right? But you have folks, your back office, your marketing folks, your bookkeeping, whomever, they are fully remote. They never come into the office, or it's a call, a call situation. They do customer service. They never leave their houses. You've never seen their faces. They're not subject to a vaccination requirement. They're not subject to, to testing. If they are coming in what I would call sporadically, certainly if you have someone who reports every, 5 days a week, those people need to be tested every 7 days, first before they start their first shift after the effective date, and then within 7 days after that going forward. The third scenario is you have someone who largely works remotely, but occasionally comes in. I have to come in once a month for the staff meeting, or I have to come in, for a supply run or something, whatever the reason. The ETS does say in those instances, this person does not test, if they're sitting at home for 3 weeks and working from home 3 weeks in a row, they don't have to test every week to work from home. If they're going to be coming into the office or coming into the work site, on the first of the month, they need to test within 7 days and show proof of test prior to entering the work site. So that's generally the rules on remote workers.
So in summary, Jim, the operating approach should really be that testing is on a week-by-week basis. If you're into the office at all in a given week, you're going to need to be tested. If you're remote that week, you don't.
Yeah, that's generally it. You have to test if you're coming in within the test has to be within 7 days of coming into the workplace. So you can't do, what you can't do is test and say, okay, I tested 2 weeks ago, I was negative, now I'm going to come in. It's got to be 7 days before you show up if you were in that sort of sporadic reporting situation.
Okay, great. Employees, and for you, employees who are terminated or quit due to not being vaccinated as a consequence of this rule, will they be eligible for unemployment?
That's really, I think we got to see how that one plays out. I would not advise employees at the front end. I don't know, if they ask, they say, the rules are the rules. Unemployment is a state-run system, with minimal federal oversight. We have seen some states already where they have instructed their state unemployment agencies that if someone is terminated for failure to get a vaccine, that should not disqualify them. In other instances, I think an employer may take the position that we require vaccination as a term and condition of employment. That's our policy, much in the way if we have a, drug-free workplace policy and you violate the drug-free workplace policy and we fire you for it, you're generally not eligible for unemployment because you were violating a workplace safety policy. But I think that's going to be a very, state by state. Some are going to be more lenient, some are going to be less lenient. I would not advise an employee one way or the other that yes, you're definitely eligible or no, you're not. The other thing will be, if there are some who are predicting that this mandate will lead to a lot of folks leaving jobs, potentially being unemployed for some period of time before they find other ones. If that happens again, and we're like we were in March and April of 2020 when this pandemic first took off and the unemployment offices were just swamped and beyond any reasonable capacity and maxed out, are you going to have folks taking slow and careful consideration, or is it going to be my employer fired me for not being vaccinated, approved and moved to the next? So I think this is one we will have to see, but it will absolutely be regional. It will be state by state. Some of that's going to just be a function of the culture of the agencies there, and some of it's going to also be dictated by state law.
Okay, thank you, Jim. Let's stay with this theme of sort of reductions in force. Question here is, if my business has 105 employees, I think you see where this is going. Despite the merits of the rule and from a purely legal standpoint, any downside risk to reducing our workforce to 99 employees to avoid all the complexities in this rule?
I'm going to beg the answer on that because they're at the nagging at the back of my brain is that the effective date for this was November 5 when it was published, and that may have been the date on which the count was made. So I don't want to give a hard and fast answer here. Let's say for the sake of argument, it's not until December 5 and you let a few folks go for purposes of getting under that 100. I don't know that I see any legal impediment to that, but I'm going to stop short of saying, between now and December 5, bring yourself from 105 down to 96 and hold it there, because I am not certain the date on which that count is made. And maybe while we're talking, I can even see if I can find that answer in front of us. But while we're doing that, why don't we turn to the next question?
Sure, we can buy you some time because that question of when the employee count would be determined at what stage in this process pertaining to a particular employer is certainly an interesting one. Let's go to an enforcement question.
Sure.
Jim, how will this be enforced in real life, would you say, and any tips for what employers really need to do now before OSHA comes calling in a workplace?
I think the things you can do are the things that are relatively low cost, low exercise. How is this going to be enforced? As I said, OSHA is a strapped agency. I'm sure Cheryl, with her time at Wage and Hour, can relate. We are not going to see teams paratrooping in on January 5 to say, show us your papers. I do think where it's more likely you'll see potential inspections is where you have outbreaks, or where there are other safety issues that are raised and OSHA is coming in to do an on-site for, an unrelated issue. I think this is going to be in the category of, while we're in the neighborhood, let's go shopping. So if we're coming in to inspect for, electrical concerns or, other workplace safety issues, they certainly are going to say, while we're here, show us what you're doing with your OSHA. So having a policy in place, communicating these things to employees that the standard requires you to communicate. This is our policy, non-retaliation, et cetera, et cetera. Being able to show we're doing that. I think prior to the effective date, I don't see, that January date, I don't see them coming in and saying, show us what you're doing. The other issue I would be mildly concerned about is if OSHA is going to jump and, target an investigation, it may come by way of a whistleblower. If you have a work site where rogue manager is just not enforcing any of this stuff and people aren't wearing masks and, people aren't being compelled to show vaccination and sort of a wink, wink, nudge, nudge. I think if you have someone who makes a complaint to OSHA, that may be in the first instance where they go.
Thanks, Jim. Cheryl had her hand politely raised there.
Yeah, I was going to add to Jim's point about you do need to watch for complaints to OSHA, because that'll be the first thing that'll get OSHA through your door. But I do also think we have heard reports in the healthcare space of OSHA coming on site to do some quick checks just to see if they're complying with the June ETS. They may pick some industries that they think are most at risk, and so do some spot checks quickly in a neighborhood, what they call directed inspections, just to see what's going on. But they will be, to Jim's point, I think very quick. Probably, they'll pick a concentration of places, trying to hit many in one day, or it'll be related to a complaint. So I do think he's right that it is your likelihood of seeing someone show up is small, but you should still, to Jim's point, be on guard.
And special thanks to one of our folks in the chat who was able to find the answer I was not able to find while we were sitting here, which is November 5 was the date for 100. So if you are at 105 employees now, God rest you and keep your mother McCree, you've got the ETS with you for the duration of the standard. So if your workforce now shrinks below 100, you are still subject to that. And I suspect some of that, is to account for fluctuating workforce, but I suspect also some of it was that folks didn't say, okay, if I have to have a certain number to get me through the holidays, I'm going to clean house at the beginning of January and get myself out of this thing. So yeah, November 5 was the effective date. So if you were at 100 or more on that date, you are covered.
Thanks, Jim, and thank you, Jennifer, for putting the FAQ link in the chat there. Very, very important. Let's see. 2 more questions. Jim, any chance that the permanent rule will require more of businesses than the ETS? And for instance, might businesses with fewer than 100 employees be required to comply with this down the road?
Yeah, I mean, that's a possibility. I don't know that it's a distinct possibility or a likelihood, but both in its, so the publication of the emergency temporary standard served as an immediate temporary standard, but also a request for notice and comment on what a permanent standard might look like. And I know that one of the questions OSHA specifically asked is, should we consider lowering this threshold or eliminating the threshold? Because frankly, it's not something they've ever done in the past. OSHA has always taken the position that an employer, a risk is a risk, a hazard is a hazard, whether it puts one employee at risk or whether it puts 1,000 at risk. So might that 100 employee threshold go away? It's possible. I know the solicitor of labor, who is not directly part of the policymaking team, but is included in these decisions, was, I think, at a conference yesterday, said we are, seeing the report I got was that, this is something OSHA is considering. Will that 100 number go lower and apply to all? And there are, I think, policy reasons why that might be good for some folks, and there are policy reasons why it might be terrible. But I see Greg's popped on for a second. So, but
yeah,
I
so
do
Jim,
think that's an issue.
I actually have a question about this. Is
Sure.
there a legal vulnerability to the law on that basis? Because if it's an emergency for large employers, why is it an emergency for small employers?
Greg, to answer your question, I think one of the weaknesses or one of the challenges to the ETS is around this 100 threshold, because, put another way, if I have 98 employees, nobody needs to be vaccinated, nobody needs to be masked, we can run around and lick the doorknobs and, it's a free for all, but I hire 3 more people And all of a sudden now my workplace is, a high risk hazard where all those first 98 plus the new 3 have to be tested or masked or vaccinated. I do think, OSHA will point in their preamble and other things to say, oh, this was, we felt this was a reasonable basis, for the cost of compliance, small business, et cetera. But I do think that 100 number, which is somewhat unprecedented, if there are places where this ETS can get poked, I think that may be one of the weak points personally.
Good follow-up, Greg, and thank you, Jim. Okay, we'll let that be the last word. I've got 2 more slides that we can show here before we let everyone go here. Jim has mentioned that there is currently a 30-day comment period on the rule. One of the things that we're going to be offering members of our Franchise Action Network is the opportunity to weigh in on the rule over the course of the next month. So please, if you're not a fan member, if you're not receiving our bi-weekly fan emails and keeping up on local meetings with your elected officials and other IFA opportunities, please do grab your cell phone, which is undoubtedly in front of you anyway, and text FAN to 52886, and you will quickly be added to the franchise grassroots network that allows us to be so impactful on public policy. And finally, again, on our final slide, again, IFA 2022 in San Diego, in person, go to franchise.org/convention to register and have your whole system attend what will be an awesome show. Matt Haller's first as CEO and our first in-person show in 2 years, at least our annual convention. So on our final slide, I think all we want to do is thank everyone so much for being a part of this. Thank you especially to Cheryl Stanton, Greg Flynn, and Jim Peretti for all you shared and all your insights. We hope you'll keep in touch with all of us as this rule proceeds. But until then, we look forward to being on another IFA Thought Leadership webinar program with you. And until then, we hope everyone has a great rest of their week and stay safe.
Thank you, Michael.
Thanks, Mike.